The purpose of this film is to spark conversations and establish touch points to guide discussions about the COVID-19 pandemic in a way that is grounded in clinician and healthcare workers' experiences. This film was created using footage from interviews of people who agreed to share their stories of working in La Clínica de Familia during the COVID-19 pandemic. The clips you will see were selected because they represent common patterns. Participant voices and personal experiences differ, but they shared a belief that telling their clinic story would matter. In some instances, people were willing to share, but were not comfortable being on video. Not everything you hear will be directly relevant to situations at present, but each story can spark ideas and conversations that allow for insightful discussion of the pandemic. Catalyst films are part of the broader, wide engagement for assessing COVID-19 vaccine equity, or WEAVE project. More information about the WEAVE project can be found at www.weavenm.org.
I work for an FQHC. We see patients from all different walks of life, those with great insurance, not so great insurance, and those without insurance. Our organization was originally just basically a ragtag group in the early mid-70s whose idea was to disseminate health information to field workers. And I think that foundation actually helped foster that trust between our providers and our COVID team and the borderland population.
And so it was just very challenging at the beginning. But what I found so rewarding is that in spite of all those challenges that we were all facing and the stressors that came along with it, that everybody was so resilient, not just like our staff, but also our patients, right? They were amazing because we've changed the whole way that we provided healthcare. I mean, it changed from one day to the next. We had to come up with innovative ways to deliver our healthcare to these patients, right?
Some places may be shut down temporarily. That was not an option for us, and it was not something that we would have even considered, that our doors were open to anybody and everybody. We actually, I think, saw an increase in referrals during COVID. People were seeking mental health services, and a lot of places were just not offering at that time, and we were. So I saw that a lot of people were very grateful for that and thankful to have the flexibility to still have their therapy.
We have dental, we have behavioral health specialties, we have early Head Start, and everybody was just kind of in their own little world, right? Like doing their own thing. But because we all had to come together, it impacted the whole organization, right? Everything you do, it's a domino effect. And so that's something that I think has really strengthened us as an organization.
It was a very stressful time for everybody, not just me as a member in the community, but also as an HIT manager. I remember being on vacation in December that year that the vaccines rolled out. I had to stop what I was doing and actually get in and build the vaccines, make sure we had the CVX codes for the immunization so that our providers could quickly get out there and start vaccinating. And the reason is there's been a lot of death around us, and getting those vaccines quickly to me was so important. So I did. I couldn't ignore the emails. I couldn't say, well, I'm out of the office right now. I'll do them as soon as I get back.
All of us were isolated, and it's hard to, see family or, friends, and then also, having relatives or family members pass away. So I think that's one of the biggest things that has affected me as, also as a person, but also in my practice.
And we would render care behind a mask, behind a face shield and a gown to patients at their door side, at literally the side of their car. We had to examine patients. We had to keep things going. And it was, if anything, a testament to our providers in our organization that they were so readily able to adapt. I'm very proud of my clinic, but there was no doubt a lot of fear. We just didn't know.
And I just remember in the middle of summer, right, it's like 100 degrees outside, and you're wearing full PPE. So it's like wearing a trash bag over your clothes, over a mask, over a face shield. So you can imagine, just it was just, horrible conditions. And we started off with a very small operation that built up, to testing hundreds a day. And eventually, we made it into a really well-oiled machine of testing and then eventually vaccinating. We vaccinated, you can say like thousands of Southern New Mexico residents, as well as testing thousands of Southern New Mexico residents.
Access is one of the biggest things we as a country, I think, still need to work on, because I hear it all the time. So if I work from 8 to 5, I can't go get a vaccine. If I miss work, I don't get paid. Those are the jobs of the majority of people. Not everyone works in a job that has annual leave, sick leave.
We did have promotoras present at some of our vaccine sites. They were all bilingual, and like I said, they're all from the community. So, some of these small communities, everybody knows everybody. So when you see somebody familiar, you can, there's that added trust.
The pandemic started, I've been the only promotora for all the clinics. I'm in communication with the other promotoras, and as I mentioned, we're about 30 promotoras, and we're all in the community from El Paso to New Mexico. So we share on both New Mexico and Texas.
Well, a lot of our patients really enjoy the telephone more so than, coming in, because it's so convenient, right? Like we have migrant workers. So, they could actually work in the fields, take a break, get on the phone and call us, and we do a telephonic visit over the phone, because we deal with a population that might not have PTO sick time, right? So maybe they only have 15, 30 minutes or during their lunch times.
Well, the good part of this organization for La Clinica is we actually had funding to have what we call a COVID team. We had the ability to get an old RV, and we took the RV to different locations to do COVID testing and eventually vaccination. It was great. We were taking through Santa Teresa, going to Sunland Park, really in the borderlands between New Mexico and Texas. And it wasn't uncommon that we have, obviously, patients from Mexico.
We're finding that our patients across the border are willing to get vaccinated. I don't see a lot of resistance. And I will tell you, we partner with Department of Health, and down at Santa Teresa, wherever our migrants are, that's where our mobile unit will be set up to make sure that they get their vaccines. And I think our patient population, they have been a lot more receptive to the vaccine than actually the general population as a whole, because I think that we're decreasing that barrier, right? Which is bringing the vaccine to them instead of them having to come to the vaccine. And I think that's important for any organization to make sure that we go to the population that needs it, and the most vulnerable population.
The rural areas were, I think, hit hard because, number one, there's no real healthcare infrastructure in the rural areas. And then most of the big cities had eventually the big testing sites where they would test like hundreds, an hour or so. But going from, the rural areas and showing that we could test and provide the services for these people, I think was the most rewarding part. I think what alarms me the most is, after this quarantine and after being isolated, I've seen an increase in the demand for behavioral health services and an increase in, depression and anxiety.
The other great thing about our organization is that we have integrated behavioral health, but, because of COVID, obviously we had to do telephonic, and our patients were very receptive just to talk to them about what are the stressors? What are some tools? How can you be able to cope with COVID and do what is your support system?
We've actually had a high amount of referrals after COVID. Is one of the things that we have a lot of clients coming here for is grief and loss. There was a client who had about 12 deaths within her support system in the last 2 years. And that speaks to what people are experiencing, even if they are fine and they are healthy. And so they have this persistent anxiety about the pandemic, right?
Little did we know our biggest enemy was misinformation. Never in 1,000 years would I have thought that I would have to teach patients to unlearn what they have learned. It was an opportunity to educate the patient, and we did, as we do with every other disease process. But it was infuriating to see people on Facebook, people on the news, thoroughly disseminating misinformation. It was undermining the very essence of what we do, as providers in the medical field. And we just felt helpless. I felt downright angry because some of these people were spreading this stuff without repercussion. When the vaccinations came, it felt great because you could put it in people's arms and you could protect them. We also ran into people who basically vilified you. Oh, you're just buying into it. This is some sort of narrative that you're just a part of. It became even more infuriating when higher-ups, even at the presidential level, had accused medical providers of somehow cashing in when it came to giving out vaccinations. But the lack of information really is what led to some really crazy things in the clinic. Patients refusing to wear masks, patients accusing us of quote-unquote being Nazis and buying into the rhetoric or the false narrative. I've never encountered that kind of resistance.
I think that just the social media sometimes makes it very difficult for some of our patients to be receptive. And obviously some patients, she's like, I think that they're injecting, this chip inside my arm and I'm not going to get it.
They were listening to the tia, to the mom, to the aunt, to the, and getting information that maybe wasn't true. And they were getting scared to get in the vaccine because politics, because they say, oh, I don't agree with it because I'm a Republican or I'm a Democrat and I don't agree with it. I don't think it works. I think it's just more virus that we're going to get into our bodies. And another people that they think that they don't need it. We have some adults that think that their kids under 12, they don't need the vaccine because they're still young.
I would say a year into the pandemic, a lot of people were still believing that, COVID was not real. But I will say this of our clients, that our clients have been very respectful of us as an agency, that even if they don't believe in vaccine or they don't believe in the pandemic, when they come in, they wear their mask and they follow what we want.
Because they hear it in the news, but they don't trust that, right? So, and a lot of community members, when they know that you work alongside doctors, they will ask you, since you work with a doctor, what are they telling you? What are they saying, Bertha? So that's important. That's important to them. And I always want to get the information from the doctors so that I can pass on the message, the correct message, and the best message.
We have to be consistent because we can't just decide to just look at every single research study that's out there and every single database or any type of news that is out there, because as we all know, there's a lot of fake news out there. So we try to explain to the patients and we try to explain, this is what we're going by. And this is why the CDC and this is the Department of Health. And this is why it's important for you to get the vaccine.
I think some people, it has helped reduce their fears and feel more confident as they see more and more information coming out about the vaccines and approvals and, but then there's also those issues where sometimes you do see the miscommunication, the fear, and, they read a story about one person who did have a reaction and then they're not comfortable because of the anecdotal evidence. And so if we take the approach of telling them you need to get vaccinated, you have to do this, then we risk the alienating our clients. And so they don't come back, they disappear from services, and then they don't get the help they need.
It's an opportunity to educate the population in terms of what research truly is, what the scientific method truly is. It's not going on Google and searching for the result you want to see. This is a practice in terms of critical thinking. Who are you going to get information from? Facebook or the CDC or The Lancet or JAMA?
But one of the most important things for us as an organization is prevention, and vaccines are so important for us. So that's very dear and near to my heart. And so that's the reason I'm such an advocate for the vaccine, but understanding that patients have the right And then we also have to be very respectful, to them for whatever decision they make. But just showing them just the data. I think that's just important. And I think that's what we should do as providers, is just provide them the information and then just allow them to make the decision. And then hopefully the next time you see them, you plant another little seed. That's the approach that a lot of our providers are taking with the patients. And I think that's how we win a lot more patients. A lot of more patients are willing to get vaccinated because they're willing to listen to the providers, because they have that respect and they have the trust, in us.
I think the government could have done a better job helping us here and say, this is a roadmap for you. And I hope now that they've learned so much from this pandemic that for the next one, hopefully I won't be alive for that, but they'll have a roadmap to say, this is the lessons we learned from COVID-19. And here's the roadmap. This is what we need to do, because we didn't have a what we need to do. It was just do it any way you knew how.
I think that's really important, number one, to be able to have a strong leadership, that everybody understands their roles and responsibilities during a pandemic or any other type of crisis situation. That's important. Then the second part is making sure that you have a buy-in, is the communication. It's constantly communicating, being clear and concise with the rest of the staff.
I felt like we needed to get more support from our government for these things, not just grant money and not just instructions, vaccines, getting the product out. Give me some support. Give me some personnel. Don't give me the National Guard when it's like too overwhelming. Give them to us first off to help us set up this all in place. I think we need more people on the ground providing education. We need more people on the ground as promotoras, as community health workers. Some of them are the lowest paying jobs, but they're some of the most important people in our organizations.
In medical school, in the medical field, there has classically been this thought where that as a provider, you can never get sick. You can never get sick. You're not allowed to be sick. Even if you're sick, there's also this expectation to come in. That was the big shift, I think, in this whole pandemic thing, was a wake-up call to providers that first take care of thyself.
And I think the pandemic has taught us that, it's better to be safe than sorry. And if there's flexibility to do your work from home, then do that. And then that way you can still take care of things without getting other people sick.
I think moving forward, being aware of that history, being aware of how science works and how we have to change policies and approaches based off the data. I think that's a lesson we have to learn from this as a society as a whole, is to question who is giving information. And if someone says take ivermectin, take an IV of bleach and do an UV enema, don't do it. But if anything, that's a lesson from this. Look at who's giving the information and question for yourself.
The telehealth and telephonic processes that we have now, but we're seeing that because so much of New Mexico is rural, that this has just opened the doors for things to be accessible to people. So I think what we've learned is that the old ways don't necessarily mean that it's the right way or it's the best way. And sometimes even through a situation as awful as the pandemic, we can have things come out of that actually benefit people as a whole.
Humankind has a very short memory. It would behoove us to learn from our history, or else we're doomed to repeat it again.
I think that in memory of so many people that we lost, so many good friends, family members, parents, I think the most important thing that we can learn from this is that as a community, we need to come together and help each other out.
The community here is an amazing community, that there have been so many different resources for people in terms of, okay, where can we go to access donations if we're out of work because of the pandemic? Where can we go to get help with things like utilities? And then looking at those little things that people have pulled together of supporting each other. People can adapt and change. Even if things are difficult, we are able to work through it.
I love my community, and I believe helping them, it's giving me a lot of peace that at least I'm doing something